The healthcare system in the United States is a complex mosaic of public, private, and voluntary agencies interacting with each other through research, technological innovation, education, training, workforce development, and the advancement of public policy. Not only does our healthcare system help create health, it also is a major economic engine. Nowhere is this complex interaction of industry, academics, and healthcare more proactive or more important than in Minnesota. We're going to look at this interaction on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at how the bioscience industry in Minnesota is interacting with educational and research institutions and with healthcare providers who use their technological innovations. In particular, we'll be talking about LifeScience Alley, the largest state-based life sciences trade association in the United States, which has a 26-year track record of enabling business success for its members through educating workforces, providing leadership on developing good state and federal public policies, supporting advancement in research and technological innovation, and fostering industry connections. Joining me in this conversation is Dr. Larry Kuusisto, Vice President of Education at LifeScience Alley and Chief Operating Officer at Alley Institute, its research affiliate. Larry, welcome to our program.
Thank you for having me.
And I think as in public health, we oftentimes don't think about sort of the business community and technological advancements as part of the public health infrastructure. So I want to have that as the frame of what we talk about. So tell me a little bit about LifeScience Alley, how it got started, what its purpose is, sort of what it does.
Right. Probably best if I take you back a little step in time. If you remember in the 1940s through the 70s, Minnesota was the home.
Well, I don't know if I remember that very well.
But we were the home of computing. We had Control Data Corporation and UNIVAC and Cray Research and, of course, IBM. What happened was that industry became personal. This was back when you and I were using typewriters. Mm-hmm. But the computing industry became personal. It went to the West Coast, and Silicon Valley was the home of computing. And what we were left with in the Twin Cities were thousands of families that had been working in those industries that were gone. And what we had, fortunately, was a young and emerging industry, the medical device industry, cardiac rhythm management products coming from Medtronic, for example, a very fast-growing industry, and those engineers and families and professionals working in that industry had a place to go, had a place to work. That industry emerged, and now we are the center of medical device in the country. So that was why we, at that point, because of that loss of jobs and the threat, at the time, Governor Perpich and Lee Berlin of Lectech and, of course, Earl Bakken of Medtronic got together and said, we don't want this to happen again. And so what can we do? So they formed in 1984, formed Medical Alley, which was a very broad-based trade association, which sets it apart from other trade associations. We're not interested just in hospitals or medical device manufacturers or insurers. We're interested in all of them. And at the time, it was focused on healthcare exclusively. But that was the basis for Medical Alley. And Earl Bakken, who has been an acquaintance of mine since I was 17 years old, I saw him 2 weeks ago, asked me the question, how frequently do you get people together? And I had to tell him 3 to 5 times a week, which was what his goal was. And the purpose for that was a story of his own, that when he was walking the halls of the University of Minnesota Hospital as an electronics technician, Walt Lillehei bumped into him and said, I've got a project I'm working on, and I wonder if you could make me this little device that sends a pulse of electricity. And Earl went back to his garage and created what was then just the principles for pacemaking. So with that, Earl saw that there was value in having people meet. People that had a common interest and a different set of skills would get together and have reason to meet and talk, and something good would emerge from that. So that's kind of the foundation principle, the reason why Medical Alley was formed. And we have since, in 2005, we merged with MinBio, which is a state affiliate organization for the bioscience industry organization. We merged with them. That's when we changed our name to LifeScience Alley. And we broadened beyond healthcare into the other industries that we're interested in. And basically, our interest as a trade association is the health and vitality of humans, animals, plants, and the environment.
So your goal is changing the world.
Yes, well, of course it is, and changing public health.
Yeah.
And through what we do in the state of Minnesota, and you talked about business development and economic development, that is a very important part of it. We take for granted that we have a very healthy state and that we have a very thriving metropolitan community. And that comes about because we have very smart people here working in these industries, and they come here not just for low taxes, they come here for quality of life. And part of a thriving industry has sustained that quality of life. So that's part of what we do.
Okay. You brought a slide along, and I want to put it up, that sort of explains sort of that ecosystem, that'll help. It's a little complex, but maybe you can just walk us through what this is showing that sort of explains sort of the scope of what LifeScience Alley is all about.
Right, yeah. It's a very complex slide, and we want everyone in the state of Minnesota to use this picture to understand better what the life science ecosystem is. Across the top, of course, the Minnesota industries, including medical device, healthcare products, food, renewable energy, and renewable materials, and we'll talk briefly about that later. The commercialization catalysts that make those industries grow and thrive, and underlying that, the enabling knowledge clusters, the kinds of technology and the people working in these areas that can support that catalytic change and sustain growth. And underlying that, of course, is the functional capabilities of education, infrastructure, and good public policy that will sustain that. So our interest as a trade association is this whole picture.
Mm-hmm. So how do you make that happen? How do you focus on those foundational things and enabling knowledge and the catalyst? What is the role that your agency or your organization does in pulling all that together?
We look very carefully at where the limitations are, where the obstacles are, and focus on those. When we joined a couple of years ago with the Bio-Business Alliance of Minnesota, which was a spin-off of a task force, Governor Pawlenty had a task force on the biosciences. In 2004, the Bio-Business Alliance of Minnesota was formed. And we have now joined with them, not as a merger, but the Bio-Business Alliance is an affiliate, as is Alley Institute, of LifeScience Alley. That has changed how we affect the ecosystem. It's changed how we look forward, and we'll talk about that in a bit.
Mm-hmm. All right, and we will talk about that in a bit, but we need to take a little break. So we'll be back and talk about some of that specifics and also how your agency relates to some of the healthcare goals on health reform. So we'll be back right after this message.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back. We're talking about the bioscience industry in Minnesota with Larry Kuusisto, the educational director for LifeScience Alley here in Minnesota. Larry, we talked a little bit about this unique kind of organization. Are there other organizations like LifeScience Alley in the country?
I would have to say that since we joined with the Bio-Business Alliance, I'll lay claim to being a unique trade association. We're a very broad-based life science trade association, and there are others like that. But with the Bio-Business Alliance, we've now looked forward. We're looking into new frontiers. We're looking into the industries and the companies that will affect the environment in the state of Minnesota, the economic environment, also the public health environment.
Okay. Well, so let's take a look at this next slide that we've got that kind of shows sort of a progression of how you actually do some of the groundbreaking stuff and how you grow it and then how you really bring it to fruition. Explain what this is all about.
Right. The right side of that slide, the top of the curve there, shows our trade association. That is a typical trade association. We have member organizations that we support through workforce development, through advocacy, through education. But what we now have is we have the Biobusiness Alliance looking out across the state of Minnesota for the new industries, new technologies, and new companies, and aggressively supporting them, finding the companies and supporting those companies and individuals that will create the new industries that serve the purposes of the life science ecosystem and support that.
Okay, and then on the left you got the incubation. But how do you do that incubation? What role does your organization play in that?
The Biobusiness Alliance is primarily focused on that aspect of what we do. We have the Business Resource Network, which is developing and growing, and we're bringing together companies and individuals who need to connect with one another, need to understand how to create a business and see those businesses thrive. And I claim that this was unique because there are agencies and organizations out there in other states and other domains that do support industries like that. We are a very full service organization. We will watch them and hand in hand with them will help them develop their companies and their industry. And then as they grow, we get to that curve on that slide where it shows that we are now supporting them as companies, as members of LifeScience Alley, and to sustain them and grow them farther.
What kind of successes have you had?
We've had tremendous success. I can't quote the exact number, but hundreds of companies have been developed by the Biobusiness Alliance already. New industries are emerging. We're becoming a leader in new emerging industries, renewable chemistry, renewable materials, that probably would not have occurred as it has without the support of the larger LifeScience Alley organization.
Created jobs?
Creating jobs, yes. Can't quote you a number, I'm not sure, but I know that we have created many jobs, and we will create many more because of the sustaining efforts of what we're doing.
And you had mentioned earlier on in your sort of introduction of we had all of these huge mainframe computers, high-speed computers.
Right.
They all went to personal computers, and we became a leading industry for electronic kinds of things. Are we still in that leading edge?
We are. The medical device industry is a maturing industry, and that's where we need to be very thoughtful about how we support those industries and support their own renewal. You see it in the medical device industry with, for example, neuromodulation as a new medical intervention, a device intervention. Also, we've seen combination products is a very important thing. We have electronics joined with pharmaceuticals and biologics, with pumps and those kinds of things. It started out with the drug-eluting stent, of course, and that was the combination, and that was something very new. But now we have these two different technologies. We have pharmacy, biologics, and electronics coming together, learning about each other, and we are there to support them and help them find ways of meeting together and collaborating and growing those.
How about in the field of genetics? Is that part of your bioscience?
It is. Actually, regenerative medicine is an important part of what we do. And that touches on a point. We do quite a lot with the University of Minnesota. The University of Minnesota is the one big research institution in the state of Minnesota. We work very closely with the university through our educational efforts, which is a part of what I do. And an example of that would be some of the breakthrough programs that we do in LifeScience Alley education. We will look at, for example, an intervention like neuromodulation. We're working on what is new in neuromodulation today, seeing what's happening at the University of Minnesota, also seeing what's happening out in the industries, and getting those people together and collaborating and making sure that the public understands what's going on, that the industry grows, and that these people meet face to face so that they can better collaborate and be inspired by what's happening.
Now, the world is changing so rapidly, and certainly in healthcare, it's changing even more rapidly than the population or the society as a whole. Do you see some new things coming down the road that LifeScience Alley is sort of saying, all right, we got some great people here who are going to take us into a new generation of innovation and technological advance?
Absolutely. It's very exciting. In fact, we of course see the things that we traditionally look at, the foundation stuff that the trade association has done for 26 years. But now with the Biobusiness Alliance, we're getting into domains that we have not been into before. And I mentioned renewable materials. Renewable energy is something most people know about, the ethanol. Renewable materials is something that's still relatively new in the public's mind. And that is, I can give you an example. If you think of how we used to see scrap steel used to be thought of as a waste product. Now scrap steel is a resource. It's a commodity. It's something that's reused. The same thing happens in biologics and in chemistry. We're taking waste products that will be transformed into materials and chemistry that can be used to create new products and to take that waste out of the environment. How does that help public health? If we can clean up the environment, that's a very important part of what we do. And of course, it's something that can't be easily measured, but it can be foreseen. You can estimate what it would, the cost of just continuing to look at waste as waste.
Now, when you looked at that first slide about some of the foundational things, it sounds like those are the things that you really need for bioscience to be successful. So what are the policies that are there foundationally that really would help bioscience industry in Minnesota really flourish?
I can't answer that question with any authority, but we do need state and federal policies that recognize that this is an important part of what we're going to do. And we have had that, and I can tell you, we work in the policy domain at both federal and state levels. And one of the things I want to bring you to that does relate to public health is that we have, a year ago, joined with the Food and Drug Administration in a public-private partnership, and we just recently have created a medical device innovation consortium. And as an example, that public-private partnership is useful in that we have, again, the foundation of what we do and what I do in education is getting people together face to face. We have FDA officials, FDA professionals meeting with industry professionals to talk things through because there's always been some measure of conflict. We really want to overcome that the best we can. There's an opportunity here. You talk about cost, you talk about the triple aim. The cost of a medical device, people will look at they'll hold a pacemaker in their hand and look at an electric toothbrush, for example, and say, they seem like the same kind of thing. But what goes into the development and the approval of an implantable device is phenomenal, and the cost is phenomenal. If the FDA and LifeScience Alley through this partnership can find ways to eliminate cost, to expedite the process, make it safe and effective and cost effective, the costs will come down. That's the kind of thing that we're doing to support emerging industries and these maturing industries, medical device industries, to change and to rapidly grow their new interventions, and it also helps in the other industries that are outside. The pharmaceutical industry in the state of Minnesota is growing very rapidly too because of that combination.
Right. Well, I'm going to talk about a couple of the other foundational things, but we need to take another little break. We'll be back right after this message.
This is one amazing truffula tree. Can you imagine a place where these grow everywhere? Yes, it's called the forest, a magical place to enjoy with your family. Ooh. So discover the forest and explore all the wonder that's there. Visit discovertheforest.org to find a forest near you.
Welcome back. We're talking about the bioscience industry in Minnesota with Larry Kuusisto, the Director of Education for LifeScience Alley. Larry, we talked a little bit about policy as an infrastructure thing. What about education? What about the workforce that we have in Minnesota? What about are we training, are we educating kids, young adults, adolescents in the right way to really be successful in some of these bioscience areas?
Generally, the answer to that is yes. And the reason education is an important part of the underlying needs that these industries have is not only the technical education, the graduate students and the professionals and the postgraduate students that are the engineers, but it's also K-12 education. That's the funnel to those industries. What we're doing is trying to transition those students into careers that will support the life science industry. The K-12 education is very important. To have a strong education system in the state of Minnesota. Public education is important because we have these knowledge industries. We have, as I said earlier, a lot of smart people here. They expect and demand to have good education for their kids when they come here. And that's a big part of, if we can continue to grow that, that will bring these bright people to the state, and education will benefit them, and we will benefit from their being here. So education is very important, and we're trying to help in the transition. We primarily focus on the transition from high school to post-secondary education, then from post-secondary education into the careers. And Alley Institute and the BioBusiness Alliance are working in those two domains.
So do you think Minnesota has the right infrastructure to continue to be a leader in the life science area?
Yeah, it sure does. It has the right infrastructure, but we're vigilant.
Yeah.
We're always looking at what we can do to sustain it, improve it, and I think we're feeling very strong.
All right. Now, you'd mentioned the Alley Institute, which is a subsidiary of LifeScience Alley, sort of the research arm.
Yes.
Tell us a little bit about that.
It is, it's actually the reason I came back to LifeScience Alley back in 2004. I was brought in as an administrator of the Palliative Care Partnership. And this is an example, again, of public health and how LifeScience Alley is interested in public health. The Palliative Care Partnership was a consortium of a number of interests of insurers and hospital systems and so on. And we were looking at ways to affect end-of-life care. You commented that we're living longer, we're living better, we're very interested in quality of life, and my background is in higher education, but I also have a postdoctorate background in public health. So my education PhD is what teaches me best how to provide the services that we have. The public health background I have is the lens through which I see things. And the Palliative Care Partnership looked at population health in a sense, because you and I and everyone in this room and everyone out in the audience will have one experience of death. And we were trying to explain how you can have a better death, a high quality death. And it's something you just don't want to think about, of course. No one does. But we're getting there. We're moving in that direction. And that has been proven to be a very high cost when people are avoiding it, not wanting to think about it. The only thing they can do is battle. And the battle means interventions to the very end. And those interventions are very, very expensive. And people coming away feeling as though they've lost a courageous battle, rather than having a very thoughtful, family-oriented, spiritual, peaceful death, as they will anyway. So that was one of the reasons that they brought me in to be part of this, and why, when I finished my postdoc, I came on as the director of the Institute. One of the things we're working on now with through Alley Institute is the Optimized Productivity Project with the University of Minnesota, through the University of Minnesota's Vice President of Research Office. We're looking at ways that the university can partner better in business relationships with the knowledge industries, again, not just the life sciences, but other industries such as mining, if you will, which is a knowledge industry, and aerospace and so on. Because in every university environment, there is some conflict, because the cultures are quite different. They're looking for different things, but there is a common bond between them, and this is what we're discovering. So we're working on this project, which is a study to improve the business relationships and find out what the obstacles may be and to overcome those. And we're working on this throughout the calendar year, and we're seeing some very interesting things already. But our intent there, my intent as the principal investigator, is to be better than the other universities we hear so much about, Johns Hopkins and MIT and Stanford. We can do better. The University of Minnesota and LifeScience Alley can do better.
All right. Now, we only have a minute and a half left or so, but I want to say, how is LifeScience Alley focusing on the triple aim of health reform? improving population health, reducing costs, and improving the patient experience. And you've mentioned some of that, but can you encapsulate how everybody else is sort of working on that triple aim? Are you guys doing the same thing?
Yeah, I think we are. We are, as I've explained and given you a number of examples of what we do, that pretty much is how we view the big picture. It's underlying everything that we do. The companies that we work with want to be a part of that. It's interesting because in this study we're finding that even though the companies and the university may see things differently, they still have that common interest in improving the quality of life for the population. This comes back to a story with Earl Bakken, one of the founders. What he does every year, he still comes back to Medtronic, and he always focuses on the patient, the value of what they do. We should always think about the patient and never think about anything else, because if we concentrate on the patient and the benefit, that's going to help. Same thing happens with populations.
All right. Well, good. That's why it's good to have you with a public health background working in there. You can focus on the individual and focus on the population.
I couldn't agree more.
Good. Larry, this has been very informative. Still a lot to talk about, but we're out of time. But thanks for being with us.
Thank you for having me.
I'll be back with a closing comment right after this message.
It's always wildfire season somewhere in America. Nearly 9 out of 10 wildfires are caused by the carelessness of humans and could be prevented. But together, we can make a difference.
Watch what I can do!
Help protect the home of our forest friends.
Come on! You can do it!
Only you can prevent wildfires.
To find out more, log on to SmokeyBear.com.
The United States healthcare system is unique in many aspects. It is one of the most technologically advanced systems in the world, yet the U.S. is the only industrialized country that doesn't have universal healthcare coverage. In addition, the U.S. is by far the most expensive healthcare system in the world, yet its health outcomes are far from the best in the world. The reasons for our healthcare system being what it is are varied and complex. An attempt to change it have not been very successful. So the question is, how can we take advantage of the unique characteristics of the U.S. healthcare system and make it more responsive to the needs of our society and make it more affordable for everyone? That's been a challenge for over half a century, and we continue to search for the answer. Obviously, I'm not going to be able to answer that question today, but I can make one suggestion that may move us closer to an answer. I think we should ask everyone in our healthcare system, the corporations, the business executives, the researchers, the technologists, the academics, the providers, and the insurance companies to focus on the triple aim of our current health reform efforts: improvement of population health, reduction in healthcare costs, and improvement in the patient experience. And use that triple aim as the frame for all of their activities. If an invention or an innovation or a procedure does not help achieve at least one of the triple aims, we need to ask, is it really necessary? A recent report states that we spend $750 billion a year on unnecessary health care. Limiting our focus to the triple aim would be a first step in reducing those costs and making us all a whole lot healthier. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.